Let me introduce you Bahar Durmaz. Bahar Durmaz is an assistant professor at Izmir Economics University. She studied at Dokuz University at Eton and received her PhD at the University of Nottingham. She's also a researcher at Cambridge. She's a research associate at Cambridge Architecture Research. And today I'm very happy to welcome her here with her very current topic, COVID-19 pandemic and public space, preliminary observations from England. So it's a current topic and it affects us all. It will affect us for quite some time. And of course, it's also an architectural, especially urban topic, because the public space is getting, I guess, different, and even traveling is restricted. So today we entered a new lockdown in Turkey. So definitely this will affect our public space here from today on. And let's see about the lecture. I'm already curious about it. And thank you very much for coming.
Thank you, William. So thanks for the opportunity and for inviting me. Thank you to Yaşar University, also Department of Architecture, for initiating such online platforms to bring people together. I'm happy to share my observations from England. As William introduced, I have been living in England for nearly almost 3 years now. It has been an interesting experience, but last 1 year being in the pandemic and being abroad doesn't make things easier. So my work is just based on my observations that I will share with you now. I'll try to understand the effects of COVID on public space, some preliminary observations from England. It's not a case study specific study, it's just like observing the daily life and mainly places in London and around London. First of all, I would like to outline the presentation. The initial stages of this presentation is presented earlier, by the way, in a conference in Izmir. So this is a different version of it, but I had to say it in terms of copyright reasons, I guess. So I would like to introduce the aim and my methods, with a brief summary of the background of the study, and some daily issues in terms of COVID pandemic in England. And then I will focus on the public space. What's changing, what are the potentials of change or different uses that I have observed. I will discuss this in under 2 different headings. The first one is controlled by the rules. How central and local initiatives, governmental strategies, and restrictions affected the use of public space. The second part will be analyzing the spontaneous use and how people use it. And then I will conclude with some reflections on the use of public space. I was interested in to understand what will be the new ways of using public space in the time of this pandemic. It all started with my personal interest. And then I started to take photos and observe the daily life and document my photos. So the effect of government's restrictions on the use of public space and physical distancing and lockdown strategies are the keys which has affected the use of public space. As I said, it's an unstructured, random, direct observation of daily life. And it also includes some content and media analysis based on the analysis of the news, reports, newspapers, and the government, very detailed government documents for restrictions. It will be also important to very briefly mention about the literature about that, although it's new, less than not even a year yet. Sorry, it has been a year. Yeah, February to February, it has been a year, but there are already published research about this potential effects of COVID on public space. The research, I can classify that the articles and the books focus on those different titles, such as use of public place, changing behavior and perceptions of the users, and safety and public health issues, mobility, accessibility, social interaction, neighborhood, and community. So these are some headlines from the current research. The other debate is like digital space versus physical space. So there are debates that physical space has declined and like we won't need the physical space any longer, everything will be digital. We won't need the shops, offices, and there will be some decline in the use of those spaces, which origins from 1970s on. We have the debates towards the decline of public realm, which first introduced by Senate in 1977. But then there are also debates that the public realm has revitalized again and back to its popularity towards the end of 1990s. And now we have the COVID pandemic and we have the new forms of public life, public living. So we don't know the answer yet if the public space will die or not, or what will happen. But in the last 1 year, we have some clues. So I hope those observations will help us to discuss and share more to see what will happen. In the literature, public space is defined as the space that is not controlled by private individuals or organizations. Hence, it's open to general public. This is the public space definition that I use in this study. Public accessible places where people go for group or individual activities. It includes streets, urban parks, playgrounds, garden centers, in-between spaces, and some public spaces in front of the buildings. So I try to include my observations for these kind of public spaces. One of the recent studies is by Yangel. He's a very famous, important scholar in the discipline of urban design. And his recent study, published in 2020, argues that public space plays a vital role in pandemic, even more important than before. They also conducted a research, a survey between the people living in Netherlands, most probably, and 65% have said that they use the places more than before. Such as it's important to mental health, people need to have fresh air more than before. And also the pandemic has really shown how much people rely on these places, especially for exercise and fresh air. And if we look at some statistics, these are all accessible online, anyone, from Google's mobility research. If you see those purple line is the parks. This graph explains the use of different spaces in the time of pandemic, and this is United Kingdom. So there's an increase in the use of public space. You can change this graphic different countries. And I also observed that in Turkey also the graph for parks has increased. Of course, there's a decline here because it was winter, very cold time. but now it started to increase again. So this is the graphic for Turkey. Of course, in the summer times, it's maximum. Declined here in winter times, but in Turkey, the use of parks or public parks is not as much as England. Only just based on this graphic, I can interpret. Let's look at some recent figures in England, which will also help us to discuss effects on public space. This is the graph based on data for 11th April. So it's only 7 now, 7 deaths. But so far it's over 100,000. You see, like, there are waves. The first wave was in earlier last year in March, June, that period, which was the first lockdown. Then we had the easier summer here. And then second wave. I believe most European countries and Turkey is having the second wave now. And in those days in January, England had like numbers around 60, 70,000 cases per day. But due to the, I think, the speed of vaccination and the very, very strict lockdown restrictions during 2 months has helped. And now the cases are nearly disappearing, around maybe 2,000 per day right now. This is a graphic timeline of UK coronavirus lockdowns. Just to give you an overall idea, of course, I won't go in much in detail. Like, there has been 3 lockdowns, complete lockdowns since last year, March. Lockdown 1, lockdown 2 was this year in autumn, November and December. And lockdown 3, which started in January and has just ended, I can say, or has just eased. The government had a roadmap, which was announced a month ago. So what they are doing is they are incrementally opening up the country. So, for example, a month ago, we were allowed to meet only outdoors, just with like two households, let's say. You can't meet indoors at all. You can only allow to meet outdoors with people. So that was a month ago. And only yesterday, the shops are opened. Cafes, restaurants are open now, but they only have permission to have people in the outdoor spaces. No one can go indoors yet. And the next phase is the 17th May, which the international travel will be allowed again. Right now, no one is allowed to leave the country except the extraordinary cases like funerals or illnesses. And then by 21st June, everything will go back to normality if the numbers, cases, and vaccination targets goes according to the plan. I would like to share some photos from the lockdown in England. As you see, the streets are empty now in those days. No life, nothing's happening. Empty streets, empty plazas, empty squares. Everywhere was with signboards, advertisement boards, trying to warn people to stay at home, for social distancing, and to keep also personal hygiene. What we have observed, increased construction works. That was perhaps a chance to improve the road works or pedestrian pavement works. Most of the buildings were refurbished. That was something, I guess, that affected the construction industry here. These pictures are taken just before the second lockdown. As you see here, most of the cafes and restaurants, they're all getting ready for the lockdown, closing down the shops, getting rid of the excess food or products, perhaps. Now in that part, I'm going to analyze the government restrictions, official government documents, and their effect on public places. And after that section, I will focus on how people use the spontaneous use of public places. Here, the government has prepared lots of documents in form of PDF accessible online, managing public places and open green spaces. I was very amazed with the details of the information and the drawings and technical explanations to explain how to manage those places. Mainly the documents are used by the municipalities. So, for example, the management of green spaces, management of urban centers, high streets, town centers, or the public places around commercial buildings, the areas around transportation hubs, marketplaces, playgrounds, and outdoor gyms. There are detailed information about how to manage those places. For example, this is the level of detail explained. So there are several decisions for each spot you see here. For example, footway widening to ensure that people can walk socially distance, or separating entry and exit routes, or moving bus stop shelters to accommodate queuing in line. So that these kind of changes also we can see in the real life, which I will show some photos. Things like that, like payment markings, widening of the footways, payments, and as you can see in the image, the control entrances, exit and entrance points, physical barriers, they are used a lot to separate the entrance and exits, and a relocated road space for cycling and walking. As you can see here, there are also people like marshals controlling those entries and exits. Some more street signs to warn people for the social distancing. It's very interesting to see all those signs, and to me, they also create an effect like of that pandemic, a huge impact, like everywhere is full of signs, warnings, directions, guidance. So you already feel restricted with that much visual dominance of those signs. Stay 2 meters apart, maintain social distance. There is a great emphasis on that here. If people apply it or not, that's another debate. But always stay 2 meters apart, 2 meters apart, like, and it's also affecting all the decisions. For example, the venues, music venues cannot open because they cannot make sure that they can provide those distances. So when this is lifted, maybe in June, things will go back to normality, I guess. This is a drawing to explain the enclosed or semi-enclosed entrance areas, public places around commercial buildings. So as you can see here in those images, again, there are signs for queuing, one-way flow markings, phasing of access and delivery times, and there are special waiting zones. I believe that they will be the issues in the future of design, perhaps, allocating those wide waiting zones and widened entry and exit areas so that people cannot get closer to each other. Or these kind of traffic light systems at the entrance pointers, phasing of access. You can only go in when the light is red, and meanwhile we have to wait here. I find this also quite interesting. This is a picture from a school drop, an early morning. Parents queue here. and to follow the restrictions. And also, I observed that people interact with each other more as they wait in the queue. I also had new friends while I'm waiting in the queue to drop my daughter. I believe they are also creating new opportunities for new social interactions. This time school pickup. So the parents are allowed to go into the garden, but extremely directed with all those physical barriers and visual guidance. And as you can see here, it's another like a temporary, a social interaction chance for people as they wait their children. And all those entrance points are quite important. These are hygiene stations at the entrances where you have to be seated before you go in, or you have to clean your hands or just follow the instructions. In and around transportation hubs, space for multiple queues this time, or waiting zones, space for interchange agents and appointments of marshals are used to direct those spaces. As I said, perhaps not directly changing the physical design of the spaces yet, but all those different color coding, the physical barriers, the signs, even those marshals are, I think, have affected the feelings and the perceptions regarding the use of public space. Always warnings about the fines. This is for the marketplaces. As you can see here in the drawings, the one-way system is quite important. You have to follow those guidance. And removing the street clutter and obstacles, and queuing system is also suggested here. And this is for the parks, social distancing in and around the parks, widening footways at main entrances and in the park, movement guidance and reducing traffic speeds, more space for pedestrians and cycles, and minimizing pinch points, reducing unnecessary clutter and obstacles, social distancing at conflict points such as junctions and cross.
Yeah, at the end we will also raise some questions, and I think like this pandemic is really something that we were quite unlucky. We didn't experience something like this in the last 100 years. So, and we don't know the full impact of it. Yeah? So the last crisis that I experienced, so I grew up in the 80s, right? So in the 80s and 90s, there was not so much going on. Yeah, we had the end of the Cold War, but generally that was a quite successful time and a peaceful time. Yeah? And then, yeah, I studied architecture, I graduated, and I started with my first job, like one of my first jobs. And at that time, the financial crisis broke out. And my design associate at that time told me, look, now the volcano break out. And okay, the volcano break out, but the dust cloud is going to come. And I didn't know what he was mentioning. I didn't know what he means, but this was really different. Yeah? And a couple of months later, they laid off the half of the staff. of a major architectural company. My personal question afterwards is especially how much of it will remain and how we will get out of this crisis, because I think the crisis just may have started and will it turn back to normal very quickly, or will it take so much time? Also, we have like all kind of conspiracy theories. The mental health of the people is affected. Every psychologist is saying that, as well as like if you compare it with the Spanish flu, the time after the Spanish flu, the Spanish flu itself was between 1918 and 1920. Even more people died there. But yeah, so especially in Europe, at that time we had the end of the Weimar Republic. We had hyperinflation. Inflation is also a topic now. And quite times of big unemployment. And that was in the end leading to social unrest and leading to the Second World War 20 years later. But we cannot say, okay, this was all coming from economical problems. But it seems that it took quite a long time to get back to normal. And in my personal area, I observed a lot of divorces. Generally, I think everybody will have social problems, maybe just personal problems of getting depressive and everything. The alcohol sales increased a lot. Together, I think, with cigarette sales and everything. So people gained a lot of weight also. And yeah, that's the question, whether this will turn back to normal quickly.
I'm sorry.
No problem. I just introduced my questionnaire at the end. I think this is a question then for everybody, because now we hear so much about this pandemic. But for me, the aftermath will be interesting, especially when you compare it with the Spanish flu. The question will be, what will be afterwards? Because now everybody's affected. We are teaching from home. There are so many problems. The alcohol consumption increased a lot.
At home.
People get depressive. In my personal field, I observed many divorces. It's difficult times. And especially when you compare this to the Spanish flu. We had the end of the Weimar Republic, we had the hyperinflation, we had the Black Friday and everything. This was quite a sequence after in these times. I don't know whether it was really so much connected with the Spanish flu or not. It was also the aftermath of the First World War. Let's not forget this. So I think it was even more difficult times. But I can just tell it by myself. Like I just watched a movie like a short time ago where a wedding happened, and this came so strange to me. Like I was thinking, oh, there's so many people. They're coming so close to each other, and they're even hugging them and kissing them. And oh, this was such a surreal picture to me that it was. I really asked myself, what's going on with you, Wilhelm? What happens? This was normal a very short time ago, and now it appears so different. And also, like maybe it's just me, but sometimes people want to talk with me, and they come closer, and I always go a step back, just because I am afraid that I get infected from this person.
And the fear of infection will affect everything, I think. Rather than the infection, the fear of infection.
And it's a fear of other people also. It's the fear that somebody else can harm you, And yeah, this is all quite, I think, interesting. And the question will be then how this is going away at the end. Okay, sorry for the try to fill the time
Thank
with
you.
these questions, because I think they are very important for us, because will it really change from one day to the other that we go back to normal, or not? Yeah? And for many people already not, because they got divorced or they started to have mental illnesses. The conspiracy theories. Many people are up to, like, not many, but a certain percentage of the society is following conspiracy theories. I personally also, I think everybody already knows one person in its circle who believes crazy stuff. Yeah? So all of this will be a question of how we get out of this at the end. Yeah, but let's have this. This was my question, like, and I think it's a question for many people, of also then how we get out of this.
How we get out.
And also, like, I don't know, also the public space, like, will we take it back as we left it, or will it be changed forever?
Very important questions, I think.
Okay,
I feel that the public place will be the helping friend. Has been a friend over the pandemic, especially in England, for many people, even for me. I wouldn't be able to survive if I didn't go to the playgrounds and parks and lakes. And that's how it helped for people to keep insane, like to keep sane, to keep the mental health on the track.
At the same time, like, I think maybe in Europe it's better because of help from the government, but I think so many shops had to close or had to stop business, and that will also empty the public space, because I think it's not so easy to go back to normalize. Okay, but let's continue with that at the end. Sorry for interrupting.
There are interesting points. Yeah, I mean, you don't have the answers, but it's very important to brainstorm, I think.
Let's keep
and as we were talking about the fear of infection, now, as I was just also mentioning, all those signs and the visual guidance, creating that effect. I don't know if they are doing deliberately or not, but they don't let you to forget it. Maybe it's the aim. And you feel more protected and, oh, okay, I need to do that. I need to do that. Check the sign. Okay, what am I supposed to do here? Always that kind of worry. And people are even worried. In a shop in Tesco, I can't even dare to put my stuff on the shopping trolley, because I did once, like, by giving maybe some 1 meter distance, I was told. So the person in front of me told me to take my stuff away. Which I thought, all right, calm down. Anyway, it's also creating that effect on people. Everybody's quite nervous and afraid, as I can see.
I think so. Everybody's a little bit irritated.
Grumpy.
But let's keep this question for the end and let's continue.
Okay. So, and this is the parks. This is a forest, by the way, rather than a park. There are like more people than before that I could observe. And whenever the weather is good, everybody's outside walking, dog walking, having the kids out, disabled people, old people, women, young people. So you can see all sorts of people using the outdoor spaces, which is a point to run away, I think. Long walks along the lakes. As you can see here, there are lots of mothers because it's crazy to stay home with kids, I think, at that time of the pandemic and the year. Although there are rules for social distancing, in reality, this is what you see. This is the other picture. Okay, in shops, people might be nervous or they are scared to even get closer to each other. But when it comes to a public space or outdoor space, if the weather is good, everybody's sitting wherever an inch space that they can sit. So this is another, I think, contradiction, which needs to be understood perhaps. People don't care. After a certain point, they just don't care. Playgrounds is another type of public place. In each playground, you see these kind of signs warning you for to-dos and not to-dos. It's again another busy area for everybody. As long as the weather is good, the parks are the, I can say, the breathing points where people do exercise, and even you can spend as much as time you want. So there is no limitation, at least. And the outdoor gyms were closed for a while, but now they're also open. I want to show you some examples from the local initiatives and in terms of the restrictions. You see two pictures here. One of them is taken in October. The other one is in November. So a month difference, same street. So what's the difference here? You can see is the initiative of the Westminster City Council to support the businesses and the shops and cafes and restaurants. So for a month or so, they were allowed to put all their tables along the street, and all the streets in Soho were used as outdoor dining spaces. So as you can see here, it says COVID restrictions. That's why this is a normally a traffic road, but just to help the business to survive, that was introduced by the Westminster City Council in the central London. And it lasted a month, and then back to lockdown again. So same street are like that, nothing is happening. And I will show you same examples, same thing during the summer street festival time, extended from September till November. And this is during the lockdown. No social distancing, I'm afraid, but people are quite relaxed to sit closer. The tables and chairs are very close. So I can't see any of those governmental restrictions and the documents. When it comes to the reality, it's, I think, difficult to manage that. And people are not that much willing to follow the rules when they're outside. No masks. This looks like a normal city life, but we see that the streets, this is a public space, a street used by the cars and the pedestrians, but now they are used by those bars and the restaurants. So just for a while, temporary while, but it is privatized for that period. I think this needs to be also discussed, to privatization of the streets, even to support the economy. Perhaps something positive at that time, but it depends how it goes on. If this might be another end of public space, I think, if they are privatized like that. You can only sit there if you drink or eat, so it's not accessible by all. That's what I'm trying to say. So now in this part, I will share you some pictures of how people uses public spaces. Again, regardless of the restrictions. These are some special photos. These are from the first lockdown and from last year, March, April, May. At that time, there weren't very strict rules for meeting outdoors, but now we weren't allowed to meet outdoors with other people. So this is a regular street, and people are bringing up their chairs to celebrate the important VE Day, having street parties, putting their tables and chairs on the pavements. Or the neighbors are talking over the fences. I think this is another way of social interaction, because people need each other more than before in these days. because being locked at home, you need some interaction, stimulation, and just going outside your door, bumping to people, talking with them, helping a lot. So, and lots of newspaper, magazine articles like that, that neighbors have become friendlier since the UK lockdown. People are having garden fence coffee mornings and chat across indoor landings or shout down over the balconies. We have seen it in also Italian cities, like people are having street parties or dancing, playing music, even playing tennis on the rooftops. So these are quite creative solutions, I think. So I'm still hopeful that we won't lose those social skills. Or this is just a concert just in front of the doorstep, but warned by the police, as you can see in the image. That perhaps someone complained. I don't know the reason. So police is also sometimes interfering. This is quite, I think, creative. This is a fence panel, which was converted into a flip-flop table. And the neighbors use it during the lockdown and having open bar. He's serving alcohol to people passing by. Or we have also seen social distancing street parties, as you can see in these images and the news headlines. Or social distance music festival. This is a new pop-up venue spaced out viewing platforms. You can only book tickets as long as you stay in those platforms, which allows like up to 2,500 people. Drive-in cinemas, they were also quite popular in those days, has increased throughout London, number of drive-in cinemas. Or like, this is quite sweet, I think. People are celebrating someone's success with their drinks sitting on the pavements. Or something like that. I believe those are the good things, hopefully will continue. And those kind of in-between spaces, front gardens like that, I believe they're all conducing or inducing more social interaction and providing spaces for people to interact. And these kind of outdoor dining pods, I guess these are all temporary solutions, but they will increase, they might increase soon. And these are some pictures from just yesterday from the BBC News. As I said, yesterday, all the shops and cafes and restaurants are open in England, but they're only allowed to serve foods and drinks outside on the pavements or in the outdoor spaces. So people don't miss those chances. I heard that all the places are like booked for 6 weeks. So you can't just go and sit there because they're all booked. People are quite crazy, I think, getting back to normality. So there are even like practical solutions to sit outside, those individual umbrellas. I would like to sum up my observations and the new emerging spatial patterns, I can say. There are lots to talk about management of public place, such as phasing, the timed closures, one-way systems, pavement widening, reconstruction of conflict points, junctions, crossing or entrances, and pedestrianization has become quite popular when we look at the last year. And increase outdoor seating. I think this will also be quite important and affect the way we design, perhaps. Social distance friendly street furniture solutions, such as individual safety personal pods or bumper tables. People just put personal pots around themselves. I have seen many examples of this in New York, America. And those sanitizing stations and zones perhaps will be a necessity to provide those kind of in-between spaces at entrance points, entrance and exit points. And if I revisit the discussion that public realm has declined or will die, or we won't need public space more, I don't agree with this yet. Based on all these observations and the news and all those things that I have read, people need public places more than before, and public realm has not declined yet. Outdoor seating, in between space, semi-open spaces will be more important than before, and they will create possibilities for social interaction. This is quite sweet as well. This is a car park in an open space, and look, people, two old women, they bring their tea, and they create a possibility even in the car park, and regardless of the weather. So this is like maybe a half an hour time difference between those two images. As I was going in, they were having their tea, and I started to rain, and people are prepared for all those things because they're perhaps desperate to have some friendly time and sitting outside. And this is my end. This is the end of the presentation, I think. That's a picture from taken from a museum in London. Some effects on lockdown. I find it is quite touching. The first case, or how people interact each other. So that's all from me. Thank you very much for listening. I hope it wasn't too long. If I don't know, I'm happy to discuss and share your observations as well.
Yeah, let's start with questions. Like, or I would like to continue with the first one that I raised. How do you think, like, how quick will it turn back to normal? And
How quick?
How quick will it turn back to normal? Especially, I mean, I think the world is quite divided, or it became more divided now than the last couple of years ago. It will also be a matter of, I mean, the companies that are producing the effective vaccinations now are very limited, and they can maybe just serve, I don't know, 1 billion people, because the vaccination also has to get updated with the mutations and so on and so forth. So let's just stay in our world that we know. How quick will it turn back to normal, and will also the public space become as it was, or will it change in some matters?
Yeah, I can only share my own observations. This is not, of course, any scientific research or anything rigorous. Based on the England, I can say that by this summer, the aim is that getting back to normality by the end of June. It looks like this will be achieved because the speed of vaccination is very important. More than half of the population is vaccinated, and lockdown measures and having strict rules on the use of public place and outdoor space, social interaction. This seems like have worked here in England, but again, it won't finish. It has to finish all around the world. Then you are safe. You can't even travel abroad. Perhaps by the end of this year, I hope it will all settle all around the world, I think. Unless we have another virus, who knows? I don't want to be catastrophic or talk about dystopias, but we never know. Anything that was a big surprise. Who would say that there will be a virus in 2020 and will change the world? It has changed a lot. I think things has changed a lot. And I don't think that things will go back to how they were before. We will have some signs, some effects on us, I think.
Definitely, but it's also like the street view. Like let's talk about this. For example, a couple of things I want to keep from this pandemic, and one of those things is the grocery. How I get the groceries. Yeah.
Grocery.
So now, the groceries. Yeah, like I get. I go to an organic bazaar once a week, and then I'm buying them directly from the farmers. But that's a very little organic bazaar, so there are not many people, and you can't get these groceries like these vegetables online so easily. But the normal groceries I order online, so they come, and I don't have to go to the supermarket anymore, which is a big relief for me. But also, for example, what everybody is ordering online, and this also has a lot of advantages. You can find very good offers, and often you can compare better, and you can also send it back if you don't like it.
Mm-hmm.
So, but this means that like the shops are becoming more maybe suburban because the rent is cheaper there, so they just have the storage and send it to the next postal office, and that's it. Yeah? But that means that a couple of stores that at the moment determining our street view, or like a big part of our street view, and also from the it affects how many people are going at the street, and it affects street life a lot. Yeah? So I guess that many shops will have to close, and that will sadden our street view, our street life. But in the same time, I'm a reason because of this, because I still want to order online, yeah, because it's quite convenient.
Online shopping. Well, before the pandemic, the world was going that direction to be more online. We were already getting used to that life, get online shopping, or online grocery shopping and things like that. Still going in that direction. But what I feel like, because people were restricted too much in that last year, now there's a desire, huge desire, when things are normal, to go out, to do shopping. We miss this a lot. And maybe that will speed up the things, I think, again. The shops still will be important. People like going shopping. And yesterday, when they open up the shops here, there people queue in front of it. In the news we watch, like in lots of parts, different parts of London, all these shops that people are waiting to go in. So then I say to myself, all right, what's happening? People are used to online shopping. What has happened suddenly? The shops are open and everyone is running in. So, okay, we are all used to that, but we also miss it a lot. So personally, I was doing my grocery shopping online, but then we got bored because we weren't going out. So then we stopped online shopping and we started to go to Tesco twice in a week, 3 times, just to do our shopping. And also it was like our only social to go to, grocery. So I think it won't be that drastic. I think we will see some kind of enlightenment or some kind of revitalization in those shops, public places, everything people missed. Now there will be more people perhaps going to the cafes and restaurants because we miss it, don't we?
Yeah, I mean, restaurants, I definitely miss. I miss friends, that I have to say.
Friends who get social.
My
Yeah.
social life is zero. And those friends that I have, I didn't see for a long time. I didn't even see my family, like part of my family for a long time. So actually, that's the thing I miss the most. I mean, on the other side, I'm lucky that I have a close family that I see on a daily basis. But definitely, it's different also for singles. I think so. Yeah? Because I mean, you have a child. She, like,
Who?
he or she, like
Who? He or
oh, like
she. He and she.
they're coming in, and that's also the funny thing because we should manage everything at the same time. And like we also see how um, uh, the value of kindergarten and of schools, yeah, so that they have a really social responsibility in our society and how much work they cover. That I figured out, I think, also during these times. Because my daughter is at home. Yeah? We have a nanny, and we don't send her to the kindergarten during these times. So, but this is also quite negative. So we want to start with school as soon as possible. Yeah, but but the singers, on the other hand, I think they have a really difficult time. So I think there's much more social media going on at the moment. Because I mean, what should you do? You can't see anybody really, and yeah.
So when things are open again, when things are back to normal, we will see more people outside.
Yeah, most probably. Like I will use it for sure. But I think especially restaurants. I mean, I was really wondering that so many people go to the restaurants, so that every place is booked for such a long time. What you showed in your lecture.
But only outdoors. We can't still go inside.
Because that's something I think I'm personally afraid of for a very long time. I think I like going to restaurants and bars so much, but
the next stage in England is opening the indoors, but it will be by 17 May.
Yeah, that's soon. Yeah, almost. That's in months from now.
Well, personally, I was quite critical to the strategies that was taken here in England since the beginning. But now, last phase, I think they managed much better than the earlier. Remember last year at the beginning of it, they started to use neydi onun adı? Sürü bağışıklığı. I forgot this English, which didn't work. And now I think they have managed much better towards the end. Bir
Yeah.
laf vardır Türkçe'de, Türk gibi başla, İngiliz gibi bitir. Aynen öyle oldu yani burası.
I think like you're already living in the future, like in comparison to the situation in Turkey now, it's very different.
Yeah, that's what I'm trying to say. But it's like this is the second or third way now. England had it 2 months ago. Now all the Europe and Turkey is having it. It's like wave and give 2 months. 2 months later, things will get back to normality, even in Turkey, I think. And now it's Ramadan. Everything goes down.
I think it depends also on the, like, especially what you mentioned on the speed of the vaccination. And in terms of that, Turkey is very dependent on China now. So because we're mainly using the Sinovacs, right? So without these vaccinations, it's a very different deal. And then of course it comes also to a comparison how effective the vaccination is in comparison to the other ones and so on and so forth. Hopefully it will come better, because at the moment we have like when you watch television, then there are experts and some tell the numbers are much too high, so it will not become better after Ramadan. Everybody's waiting for a relief, for light at the tunnel. So it's a difficult situation at the moment for us here. And yeah, hopefully we will come through that healthy.
Yeah. We can only hope. We don't know yet, but.
Okay, are there any questions left? If not, we would, yeah.
Or any comments? Don't know. Anything that you don't agree or?
I think like we are all living the same situation now. So most of us are, I think, on one page. But the second part was also the conspiracy theories. I mean, we have seen this in a short time ago in the United States, where with this Capitol, where people were entering the Capitol, and yeah, and tried to start a dab here, or like tried to overthrow the government.
Yeah.
So that was, yeah, but this was based on conspiracy theories, and they have a highlight in these times. But yeah, most probably it will go away, I guess.
Let's see. Hopefully by summer, that's my hope. Then I can come to Turkey.
Yeah,
hopefully.
That's the funny thing, that because we had the Brexit, and I don't know about any other country with these kind. I think China has also very strict travel restrictions. I'm not sure about New Zealand and Australia, but in the area of Europe, I just know it about the United Kingdom. I think there's no other travel restriction at any other country at the moment.
Any other country? Sorry?
No, I don't know about any other travel restrictions. Today I was reading about Russia, that there is a travel restriction, but there's no other country.
Turkey banned the flights from England. We can, yeah, when we had the England variant a couple of months ago, Turkey banned all the flights directly from England. So even though England lifts the ban, I cannot come to Turkey directly. I need to come via different countries. If Turkey doesn't cancel it.
I didn't know that.
But just for England.
Yeah, but it didn't help at all, because now our health minister just said that 85% of the virus is the English version at the moment, the English mutation. So
well, it is all getting better here.
Didn't change much. Okay, thank you very much for your lecture, and I hope to see you at some point again here in Turkey.
Hopefully. Thank you very much. So I hope it gets better in Turkey as well.
Yeah.
In the world, then we will have more freedom.
Hopefully it will ease in the summer, and then we have more freedom.